Well, it's a common virus that's been around for a long time, but we are just starting to learn more about RSV, and that's because it's on the rise this year. And as Marcy Rubin reports, it's hitting our young children hard.
In healthy adults and older kids, RSV causes mostly mild cold-like symptoms. But in the youngest of our children, it can be a lot worse.
In babies, what we are worried about is if babies get bronchiolitis or pneumonia.
Hospitals nationwide are seeing a spike in infants coming in with those concerning illnesses. That includes the Hackensack Meridian K. Hovnanian Children's Hospital at Jersey Shore Medical Center. Pediatrics chair Dr. Harpreet Hall is also concerned with how much earlier they started seeing cases this year.
Timing is unusual because we typically see a winter peak for RSV. But here, this started actually a few months ago, and now the cases are starting to rise.
So what's causing that rise? Apparently, it's something else we can blame on the COVID pandemic.
During the pandemic, children may not have been exposed to the number of viruses that they typically get exposed to. Many of them were at home, so their immune systems didn't have the chance to develop immunity against some of the more common viruses.
He tells parents to be on the lookout for signs of severe illness in their babies, including high fever, difficulty breathing, heavy breathing, or dehydration. That is when it's time to call your pediatrician or come to the emergency room. In Neptune, Marcy Rubin, News 12, New Jersey.
Doctors advise focusing on prevention and going back to pandemic-style behaviors, including regular hand washing, social distancing, and if you're sick, stay away from others, especially the very young and elderly.